Welcome to the Eye Essentials episode series. I'm Dr. Joseph King, and today we're looking at Adie's pupil, a fascinating neurological condition that affects the eyes. Adie's pupil is more common than you might think, and while it can be concerning when you first notice the symptoms, understanding what's happening provides significant peace of mind. We'll explore what causes it, how to recognize it, and what can be done about it. Before we begin, this information is educational and it doesn't replace professional medical evaluation. If you're experiencing unusual eye symptoms, consult an eye care professional. So what is Adie's pupil and what causes it? Adie's pupil is a neurological disorder affecting the nervous system, that network of your brain, spinal cord, and nerves controlling automatic functions like blinking, sweating, and pupil response to light. Your pupils normally constrict in bright light to protect your retina and dilate in dim conditions to let in more light. It's like having an automatic camera aperture in each eye. With Adie's pupil, this automatic adjustment system becomes impaired. The affected pupil, usually just one eye, becomes larger than normal and doesn't respond properly to bright light. Instead of constricting quickly in sunlight, it barely responds or responds very slowly. What causes this? The honest answer is we don't know for certain. Tiny nerves called ciliary nerves control the muscles in your iris. That makes your pupil larger or smaller. In Adie's pupil, these nerves become damaged or they don't function properly. Most specialists believe this nerve damage is often triggered by a viral or bacterial infection. You might not even remember being sick, but your immune response may have inadvertently affected these delicate nerve pathways. Another theory involves autoimmune processes, where your immune system mistakenly attacks healthy tissues, including these pupillary nerves. The important thing to understand is that Adie's pupil typically isn't a sign of a serious underlying brain condition or tumor. It's usually an isolated problem with these specific nerves, not part of a larger neurological disease. This is why proper evaluation by an eye care professional is crucial. They can distinguish Adie's pupil from other conditions. Recognizing the symptoms. The most obvious sign is pupil asymmetry, one pupil noticeably larger than the other, particularly in bright light. The affected pupil might be 2 to 3 millimeters larger than normal. Patients often first notice this in the mirror, or a family member might point it out. But the real problems come with how this affects vision and comfort. Many patients develop significant light sensitivity, photophobia. Stepping outside on a sunny day becomes uncomfortable, and even normal indoor lighting might feel too bright. This happens because the pupil can't constrict properly to limit light entry. Here's the interesting part. The same nerves controlling pupil size also help control accommodation, which is your eye's ability to focus on near objects. When these nerves are damaged, your eye has difficulty adjusting focus for reading, computer work, or detailed tasks. Many patients describe relatively normal distance vision, but struggle with reading, having to hold books or phones further away than usual. Now, here's something surprising. Adie's pupil can cause symptoms seemingly unrelated to the eyes. Many people develop absent or diminished reflexes, particularly the knee-jerk reflex. This happens because the same nerve dysfunction affecting the pupil can affect other parts of the nervous system. Excessive sweating is another non-eye symptom commonly reported, related to autonomic nervous system dysfunction. In rare cases, less than 20% of patients, both eyes can be affected. Occasionally, instead of being too large, the pupil fails to dilate properly in low light, making it difficult to see in dim environments. Diagnosis and treatment. Adie's pupil can usually be diagnosed during a comprehensive eye exam. Your ophthalmologist carefully observes your pupils under different lighting conditions, using a bright pen light to see how each pupil responds. In Adie's pupil, the abnormal pupil constricts much more slowly than normal, if at all. One of the most definitive tests involves special diagnostic eye drops called pilocarpine in very dilute concentration. These drops have minimal effect. However, in an eye with Adie's pupil, these drops cause the abnormal pupil to constrict significantly because the damaged nerves become hypersensitive to certain chemicals. Your doctor also performs a slit lamp exam, a device that magnifies and illuminates your eye structures. Sometimes close examination reveals subtle nerve damage signs not visible to the naked eye. In some cases, your ophthalmologist might refer you to a neurologist to ensure that there are no other neurological issues and document the extent of autonomic nervous system involvement. For treatment, while there's no cure that restores normal nerve function, there are very effective ways to manage symptoms. For light sensitivity, often the most bothersome symptom, good quality sunglasses that block UV light and reduce glare are your first defense. Some patients benefit from prescription sunglasses or photochromic lenses that automatically darken in bright light. Your eye doctor might prescribe special eye drops that temporarily constrict the pupil, typically a weak pilocarpine solution. These can significantly reduce light sensitivity and glare. Some patients will use them daily, others reserve them for bright environments. Reading and near vision problems often respond well to prescription glasses with reading correction or progressive lenses. Because the eye has difficulty accommodating for near tasks, appropriate magnification restores comfortable reading and computer use. For night driving, special eye drops can help reduce glare from oncoming headlights. Here's something encouraging. Some patients experience partial recovery of pupillary function over time, typically gradually over months or years. While complete recovery is uncommon, many find symptoms become less bothersome as time passes. Living with Adie's pupil in conclusion. Adie's pupil is not progressive. It doesn't get worse over time, and it's not life-threatening. With proper sunglasses, potentially anti-glare drops for night driving, and appropriate prescription glasses, most patients manage very well and continue all normal activities. Always inform other healthcare providers about your diagnosis. Unequal pupils can be a sign of serious neurological problems in emergencies, so medical staff need to know yours is a benign, pre-existing condition. The key is getting an accurate diagnosis from an eye care professional who can develop a management plan tailored to your symptoms. Most patients with Adie's pupil live completely normal, active lives. Thank you for joining me today. If you found this helpful, please subscribe and share. Until next time, take care of those eyes.